Welcome to this part of the seminar on new strategies to overcome drug shortages. My name is Stefan Grösser, and together with Helena Jänser, we did some research on the topic of medicine shortages in Switzerland. First of all, the disclosure of conflicts of interest. As I've said before, I'm employed at the Public University of Applied Sciences, at Bern University of Applied Sciences. This work has been funded by the EU Cost Action, what you can see, and also a Swiss Science National Foundation project, both of which have been in collaboration with Helena Jänser, and also there has been internal funding by our university. Otherwise, there's nothing to declare. You see the report on the right-hand side. Helena has already hinted to this source. Control of learning success. Here are three statements which are of importance to you. You have to, at the end, say if they're true or false. You see those. One of the root causes of drug shortages is our different definitions of what a shortage situation actually constitutes. Or the second is simulation modeling is not an adequate methodology to address shortage situations, true or false. And the third, it is possible shortage situations in a sustainable way from the perspective of an individual position in the supply chain or medicine supply chain. So to be able to answer those. Well, in this presentation, I will report shortly on a simulation study, what we did within those projects. The simulation study has the objective to show the cause and effects for medicine shortages. And for this, we need an overview of what the courses are. And of course, there's a lot of literature on the courses of medicine shortages. What we have done in our project is we tried to condense this literature and find out what are really causes of medicine shortages. We have put them into 5 buckets, if you want. Those buckets are on the top level. You see them here. I underline them for a second. And the first one, and I will not go in detail in everything here. The first one is related to economic and business decisions. So causes due to business decisions. And for example, let's take this example down here, inventory practices. So nowadays, very modern and current is that inventory should follow the lean management principle, meaning you should try to minimize your stock as good as possible in order to save resources, to have fewer inventory carrying costs. So this is one logic which is out there in business, and by itself it works, of course. But if you have an interconnected system like the supply chain for medicine, then when several of the actors in the system have this policy, this of course can create medicine shortage problems. Then let's go perhaps for the production related reasons. You see several here. What are reasons due to the production part? And let me find one. For example, limited production capacity. This one here, that production capacities are of course limited. And then if the demand changes, for example, the production capacity is too little and you can't fulfill all the demand which is there. And also you can't easily increase very quickly the production capacity due to protocols you have to fulfill and so on. So this is one reason in the area of production related. Then of course demand related. For example, if there is an unexpected, and I think this unexpected is very important, increase in demand, which has not been foreseen in the system, that this over demand, if you want, cannot be fulfilled. Another one, and we did this categorization before the COVID pandemic. You see here at that time already there was an increase of demand due to epidemics, for example. This is again a kind of unexpected increase, and this can lead to shortage situations. Then the fourth box of possible causes are in the area of price and reimbursement regulation, and there you see several of those reasons why there can be a shortage situation. For example, down here, health insurance does not cover this product in the list of products which is reimbursed. And the last one, market access related reasons. for example, that a company with product decides not to enter a market due to the small size of the market, and by this, the product is not available in this market. So again, here a list of reasons, and this was our starting point, having identified those causes, also in interviews with our interview partners in our research project in Switzerland. Then we have developed from this a simulation model. We use the methodology of system dynamics. It's a differential equation methodology, and if you want to read more about the methodology and the content of the study and so on, down here you find the Springer source where all of this is available. It is a causal model, and we have tried to include in this rather generic model common primary and secondary causes of drug shortages. In the case of oncology drugs, that's right, but the model can be applied to other drugs as well. It has to be parameterized in a different way. It is in principle a structural overview of 3 different tiers. We have decided to do it this way due to the insights from our interviews. And the tiers are raw material producer, finished products producer, and at the end, hospital pharmacy as the tier which provides it to the patient. Of course, we did not receive the perfect amount of data for parameterizing the simulation model. Data is scarce and protected sometimes. So what we could not do is to use a traditional reference mode, a historical data mode, to optimally parameterize the model. But we have a structural model, and we did all the necessary validity checks on the model structure, so we can say it's a sound model structure. Here you see what is included in the model. As I said, 3 tiers from the left to right, and everything what is within the green scope, within the green boundary, is actually included in our simulation model. So everything in the green area we have modeled as an endogenous element. So we have a model with approximately 500 variables which influence each other in an endogenous way. Here you see that we have direct connections within the model with the solid lines, so that API manufacturer produces APIs and then delivers it to the final product manufacturer directly. You see that we only have included 1 in each tier and modeled this decision-making logics very, very detailed. So how an API or an FP manufacturer actually reorders products from the previous stage of the supply chain. This is very explicitly modeled as so-called policies. Of course, there are many other manufacturers outside of our model boundary. Those we did not model explicitly, but we included their output, let's say, in our model, but we did not include their decision-making. And here is a small view of the model. And I say small because you see a certain number of variables, but as I said before, we have several hundred variables, but this is now here only the API manufacturing perspective. And I want to detail a little bit what we have modeled here so you understand the kind of model we've developed. As an API manufacturer, well, we have, of course, here our material in so-called stocks. This is the material inventory. And when we purchase material, this is coming in here. It's like flowing in like water into a bathtub, flowing into the material inventory. On the other side, if you use this material for production, so you want to produce your API, you have to use up your raw material, and then the inventory is drained. At the same time, when you produce, of course, your inventory of API, of product you want to sell to the next tier level is then being increased, right? So I hope this stock and flow thinking, you can grasp that by this short presentation. This is one element in the model. And then the next one is that the decision-making logic is included as well. For example, let's take the inventory. This is your current inventory level. Then you, as a manager person, you have a safety stock coverage. This is a variable you manage, you try to achieve. And based on those 2 variables, you say, adjust my inventory. I have to reorder. I have to produce. And this is then what is called desired production rate. This is what you want to do. And your inventory tells you how much you have to produce in addition, but also your expected order rate tells you what you should produce. This is your midterm expectation of what the demand in the market is. And you can already see when there's a sudden change in the demand from the market, your expectation does not fit here. So this is one reason for medicine shortages. So the desired order production rate is here. And then what is feasible actually is determined by what you have yourself in raw material inventory. So if this inventory is empty, let's say, of course you cannot produce. And this is represented here. But if both is, let's say, adequate, you have material and you have right desired production rate, then you go in and have the real production rate being here. And I hope you see this somehow closes a loop, so-called control or feedback loop, which is going on in reality. And this we have tried to include in our model. So if we go for a short example, then we see here on the left-hand side, inventory coverage as an important variable, for example. We see the 3 tiers and that in a steady state, the system is stable. Everything is fine. Your inventory covers your demands. But then we have introduced here here at this first tier, the API inventory coverage, a shock situation that there was no additional supply of your raw material. This then leads, of course, to a drain of your coverage. And this coverage drain you see is then passed on to the other tiers here in the case of the final product or in the case of the hospital pharmacy. Okay, you see it's rippling through the system. In this case, it was not as strong as it could be, the shortage situation. So the hospital pharmacy still had something in inventory, so this was not directly reaching the final patient. But if the push at the beginning would be stronger, you would have a shortage situation. But all of this is calculated by the model internally. This is what I meant by endogenous calculation. So what are the take-home messages here? First of all, what we have developed is a sound supply chain dynamics model, which can cover several of the major reasons for drug shortages. It is in principle a decision support which can help you to understand the system better. And it can also help to design better policies. And when you have better policy design, help you to improve your understanding of the system and the shortage situations. What is needed more is time data and better access to your systems, the ERP systems. What we have achieved is that we have now a system with which you can focus on your major leverage points and try to identify what is really critical to the security of supply of medicines.